Hello and welcome to this super interesting session on how cities have been dealing with COVID in terms of contracting and managing infrastructure and assets in cities. I'm Diana Lopez from UNDP. I'm just going to give you a little bit of logistics about the day. So we are recording this session, so it will be available on the YouTube later on. I just wanted to tell you that we have interpretation, so you can switch from English and Spanish by clicking on the little world that you have on the bottom of your screen to the right. So please switch between Spanish and English because our first speaking will be speaking in Spanish. I'm just going to advise you to give any questions that you have. This is going to be a participatory session, so please use the chat, and maybe we have time, we can give you the floor as well to intervene in public. And then finally, I just wanted to give a brief introduction about the institutions that are organizing today. So this is a joint effort by 3 UN agencies, UN Capital Development Fund, UNDESA, and UNDP, together with the Global Fund for the Development of Cities, FMDV. So without further ado, I'm going to give the floor to our wonderful moderator, Aida Arutyunova, who has dedicated her life to work on anti-corruption at UNDP. She's a program manager of the Global Anti-Corruption Initiative of UNDP in Singapore, but working globally. She has also support country offices, and she has been very nice to be today with us and drive this discussion. So Aida, the floor is yours.
Thank you, Diana. Hello, everybody. Good morning, good afternoon, good evening. It's evening here in Singapore, so I would like to welcome our participants, our speakers, to this very interesting discussion today on managing infrastructure assets in times of crisis. This webinar brought together representatives from local governments from different countries, our UNDP colleagues in country offices, and I look forward to fruitful discussions today. So prior to starting the discussion, I'll talk a little bit about the objectives. And first of all, of course, we all know it's been now more than a year that we live with COVID-19 pandemic. And of course, local, regional, and national governments have been at the far front, and they have been the first responders to keep essential services running, providing safe public spaces, maintaining food supply chain, and they have faced lots of challenges in performing their responsibilities. And in this context, most of governments have found themselves in full emergency mode. So to adapt to a situation, they had to make difficult decisions like reallocated budget priorities, often stretching already limited resources. And, all of these issues brought really to challenging times for local governments. And of course, effective asset management has become critical in overcoming this crisis, because poor asset management leads to inefficient procurement processes where there are lots of corruption risks, of course, unsuccessful public-private partnerships, whilst we all know that good governance, transparency, accountability through asset management ensures that governments can respond swiftly to the urgent needs of the population in times of crisis. So the objectives of today's webinar is to engage, first of all, with all of you to get the richness of the experiences that all of you have. But most specifically, we would like to share the knowledge in the management of local infrastructure assets across health and non-health sectors during COVID-19, identify what worked and what didn't, and have an honest discussion regarding procurement processes, public contracts, adaptation of existing public-private partnerships, and talk about recommendations. What lessons have we learned? Because this has been new to everybody, to public sector, private sector, civil society, and international organizations. And of course, to explore how effective asset management can help mitigate the impact or prevent it at the onset, and to, help us to address similar issues in any upcoming emergency that I hope won't happen, but, we should be realistic as well. So without further ado, I think we all know now the objectives. We are ready to listen to our speakers, and it is my pleasure and honor to present our first speaker, Mr. Raul Lopez Maldonado, who is a Deputy Mayor of Malaga City Council in Spain, responsible for urban development and public infrastructures. Among rich experience of his bio, I have highlighted the following: that Mr. Maldonado was a manager of the Municipal Parking Authority from 2015 to 19, and a deputy mayor for accessibility, mobility, and parking from 2011-2015. Mr. Maldonado, I would like to hear your thoughts about how you dealt with COVID-19 response and recovery in Malaga City by focusing on managing how you manage social and cultural assets, and how have you utilized infrastructure to keep people engaged, especially the most vulnerable ones, and how they have funded such actions. Over to you. You have 10 minutes. And just to remind colleagues, participants, that you could post your questions in the chat box. Thanks. Over to you.
Muy buenos días, muy buenas tardes. Hello everybody from Spain, from Malaga. Es un placer poder compartir con todos ustedes la oportunidad de mostraros cómo se ha hecho de la evolución desde Málaga de toda la afección al mundo del coronavirus, a toda la afección sanitaria que hemos tenido a nivel mundial. Quería mostraros, mediante estas pequeñas diapositivas, cómo hemos impulsado la gestión sanitaria y la atención a las personas que más lo necesitaban en esta pandemia. Málaga es una ciudad ubicada en el sur de Europa, aproximadamente de 700.000 habitantes, y sería interesante que todos conociéramos que para nosotros, para la ciudad de Málaga, ha sido muy importante conocer, tener una infraestructura, tener una estructura organizativa a nivel nacional que ha permitido gestionar de una manera más eficaz los recursos que le llegaban a los ciudadanos. Podemos circunscribir que en nuestro país existen tres elementos políticos de actuación de cara al ciudadano. La política estatal, que gestiona y coordina toda la política económica, también las relaciones institucionales e internacionales, y la defensa y los cuerpos y fuerzas de seguridad del Estado. Una política autonómica de menor ámbito de actuación, que gestiona la política sanitaria, que gestiona la educación y la protección del medio ambiente. Y una política local que gestiona el acceso más directo con el ciudadano, la gestión de los recursos, la limpieza, el urbanismo, la movilidad. Que existan tres gobernanzas para actuar para cada problema nos ha permitido diferenciar, separar y tener ámbitos de actuación muy concretos. Así, todo lo que es la actuación desde el mundo sanitario se ha tenido en cuenta desde la política autonómica. Quizás en la crisis de esta pandemia, la mayor atención o la más importante ha sido la sanitaria, pero derivado de la atención sanitaria hemos obtenido una serie de necesidades que hemos tenido que ir cubriendo. Se han tenido que tomar decisiones en cuanto a tomar una declaración nacional de estado de alarma que se tomó el 14 de marzo del año 2020, meses después del conocimiento de la afección por esta pandemia, y que ha marcado un escenario legislativo en el cual nos hemos podido amparar todos para ir tomando decisiones. Se han modificado normas, se han impuesto normas mediante este decreto a nivel nacional del estado de alarma. Se han paralizado actividades no esenciales y nuestra Constitución no posibilita, mejor dicho, que se actúe de esta manera. La garantía de los derechos fundamentales ha originado que tengamos que realizar nueva legislación de urgencia para cubrir, sobre todo, la demanda ciudadana, sobre todo para conseguir que aquello que nos requerían los ciudadanos pudiéramos cubrirlo. Básicamente, el mantenimiento de los servicios públicos, la garantía de la seguridad ciudadana y, sobre todo, la protección de la salud. Para actuar y dar servicio y mantener todos los servicios públicos, era necesario y fundamental mantener la contratación pública, poder requerir a las empresas que prestaran los servicios y debían hacerlo en un entorno de igualdad, de transparencia y de no discriminación, que son los tres principales servicios o principios que rigen la contratación pública en España. Fruto de la pandemia, hemos desarrollado una plataforma de contratación del sector público que lo que ha permitido es poder tramitar toda la contratación online, de manera que no era necesario asistir, que no era necesario estar o acudir a las instituciones públicas para la tramitación de los contratos. Toda esta nueva o reformada legislación ha permitido poder actuar de varias maneras. Hacer una tramitación ordinaria para aquello que no era muy urgente, que fruto de la pandemia debía continuar, pero no era un elemento esencial y urgente, como el arreglo de una carretera o el arreglo de una infraestructura. Una tramitación de urgencia para todo aquello que, debido a la pandemia, era necesario incorporarlo y llevaba un proceso de contratación diferente, y una actuación de emergencia para aquellas cosas que no podían ser demoradas en el tiempo, y la ley nos ha permitido hacer esta actuación para salvar los tiempos. Os voy a poner un ejemplo, porque al final todo se traduce en la capacidad que tengamos de visualizar qué hemos hecho. Este es el mayor caso de éxito que hemos tenido en España sobre una actuación de emergencia provocado por la crisis del coronavirus. Se trata del hospital dedicado a la enfermera Isabel Zendal. Está en Madrid, es una actuación que se construyó en 6 meses, es un hospital dedicado exclusivamente a la atención de afectados por coronavirus, y utilizamos el procedimiento de emergencia para minimizar los tiempos en la contratación pública. Eso ha permitido que este hospital tuviéramos las primeras noticias de él en el mes de mayo del año 2020, pues justo mes y medio después de la declaración de este estado de alarma y del confinamiento en el país de España, y en 6 meses fue inaugurado, en diciembre del año 2020. Hemos visto cómo en otros países se han construido hospitales en poco tiempo. Nosotros hemos sido capaces de construir un hospital en 6 meses que atiende a más de 960 camas, con 20 unidades de hospitalización, con 48 camas para cada unidad y con 48 puestos UCI. Este es quizás el elemento más significativo de cómo se ha agilizado la contratación en España provocado por la afección de la pandemia. A nivel local, desde el ayuntamiento, desde el que me dirijo a todos vosotros, quiero trasladaros que hemos hecho una actuación a todos nuestros vecinos que más lo necesitaban, en el momento en el que más lo necesitábamos, pero también nos hemos preocupado de saber qué pasaría una vez que finalizara esta pandemia. Por eso hemos entendido que tan importante era avanzar en la pandemia como saber qué hacer una vez que ésta terminara. Seguro que nos encontraríamos con una situación complicada, con muchas personas con necesidades y sobre todo sin empleo. Por eso nuestro alcalde, Francisco de la Torre, emprendió un plan de reactivación de la ciudad de Málaga por el impacto del COVID. Y así reunimos en plena pandemia en un salón multitudinario donde se citaban más de 200 personas, pero muy separadas, y sobre todo que podíamos seguirlo a través del desarrollo en streaming de la actuación. Hemos organizado 6 actividades, 6 foros de reactivación de nuestra ciudad y de nuestro país. Un foro con todos los especialistas en sanidad para que nos dijeran cómo podíamos obtener mascarillas, qué teníamos que hacer test de antígenos, buscar más inversión para las vacunas, en definitiva, que nos alertaran de cómo salir de una manera segura de la pandemia, pero también de qué medidas teníamos que tomar durante la pandemia con los parques infantiles, con el agua corriente que había en las fuentes o con la movilidad. Una segunda mesa de cohesión social donde nuestro lema era que nadie se quedara atrás, que todos deberíamos salir juntos de esta pequeña crisis o de esta gran crisis a nivel mundial y que sería muy importante tener la opinión de la sociedad civil para gestionar los programas de los próximos años en nuestra ciudad. Una tercera mesa con todos los especialistas del sector turístico, porque España es un país donde al año es visitada por más de 80 millones de turistas. Necesitábamos ofrecer una imagen de turismo seguro, necesitábamos ofrecer una imagen de ciudad segura y para eso hemos también desarrollado una mesa sobre la reactivación económica en el turismo. Era importante, y así nos dimos cuenta durante la pandemia, del sector de la innovación. De pronto, todo el mundo necesitaba...
Mr. Maldonado, apologies. If you could wrap up in 2 minutes, apologies. We are running out of time.
Okay.
Thank you.
Okay, thank you very much. Necesitábamos, como decía, una mesa de la innovación para coordinar el nuevo modo de trabajo, la ciudad del teletrabajo y también sin duda, nuevos desarrollos logísticos para todas las entidades que utilizaban ahora el reparto como elemento normal. No hemos dado cuenta durante la pandemia que esto ocurría. Y una tercera mesa también para la regeneración del transporte. Durante el confinamiento, para ir acabando, hemos celebrado todas las mesas de contratación para todos estos servicios de manera telemática. Hemos conseguido contratar durante este periodo 50 millones de euros en actividades propias para reactivar la economía. Hemos intentado cubrir el tema sanitario del agua potable, del transporte público, fumigando a diario, la garantía de los derechos sociales, la actuación a todos los vendedores que existían en nuestra calle en el día a día, todos los mercadillos de nuestra ciudad. Hemos cerrado, higienizado y mejorado todos los parques y jardines donde las familias compartían su tiempo y sobre todo nuestras playas y nuestro servicio público. Es para nosotros un honor y un privilegio compartir con todos ustedes la, sin duda, actuación mejorable, pero dedicada en piel y en alma a todos los ciudadanos para conseguir que la pandemia haga el menor afección posible a nuestra ciudad. Thank you for all. Thank you for you are welcome. Yes, every day in Spain.
Thank you very much, Mr. Maldonado, for your very interesting presentation. I have highlighted main measures which are quite interesting about dealing with emergency situation and how to deliver effectively services to the citizens. So first, you spoke about amending legislation and making it in line with the needs of the time. Then the online service delivery, the platform, which is really very important. And emergency procurement, just making sure that the procurement is done in a transparent way where, you know, there are no corruption risks engaged, because when you do emergency procurement in an emergency situation, naturally, then this issue becomes very important. And last but not least is engaging citizens through various forums and listening to citizens and then taking their opinions into adjusting the procedures, policies, etc. I think this is indeed very interesting example. But my follow-up question, let me also check if we have any questions, and please feel free, dear participants, to post your questions. I have two follow-up questions. So first one, if you could say 2 or 3 lessons that you learned, what would you do differently now looking back, and you know, when you have more time to assess the situation, it will be good to know your opinion. What would you do differently? 2 or 3 things. And then I will also elaborate. If we don't have any other questions, I will ask you my second one. Thank you.
Bien, efectivamente, la modificación legislativa nos garantizó poder actuar y poder seguir prestando los servicios. Para nosotros había 2 elementos fundamentales: la garantía en la contratación pública y la participación ciudadana para oír sus demandas. Sin duda, si algo hemos aprendido de esta pandemia es que no tenemos o no hemos tenido una capacidad de respuesta rápida e inmediata a las necesidades de los ciudadanos. Creo que las administraciones públicas, garantizando la transparencia y la seguridad jurídica, deben de dotarse de herramientas que le permitan buscar soluciones más inmediatas para cubrir las necesidades básicas de un elemento sobrevenido tan importante como una pandemia. Creo que conjugar, que mantener la seguridad jurídica y la necesidad de actuación dinámica, rápida, no es fácil, pero creo que el reto está en compartir aquellas buenas prácticas que se hacen en otras ciudades y que nos permiten tener velocidad de respuesta. A veces hemos dejado sin atender a algunos ciudadanos porque quizás no hemos encontrado el camino. Creo que ese es el mayor aprendizaje que debemos apuntarnos, conseguir que nadie se nos quede atrás.
Thank you, Mr. Maldonado. The second question relates to the public procurement, and I think we we also have our next speakers elaborating about that. So we know that in some cities, in some countries, due to emergency procurement, there were some corruption risks, transparency risks, etc. And some countries have established online platforms, for example, where civil society organizations could monitor to who the contracts were granted, how the process has taken. In case of Malaga City, could you briefly elaborate what specifically have you done? Thank you.
Sí, efectivamente utilizamos la plataforma online para dar información de todas las contrataciones que se hacían, pero además utilizamos medios como Facebook o como YouTube para publicar mediante vídeos las mesas en las que se contrataban los servicios, de manera que ustedes pueden visitar en cualquier canal compartido todas las mesas de contratación que durante la pandemia, durante más de un año, más de 20 mesas han adjudicado todos los servicios que se prestaban en nuestra ciudad.
Thank you. Thanks a lot. I think we'll have more questions to you in the end of our session. So now I will move to our second distinguished speaker. And I would like to introduce to you Talita Schwartz, who is Subsecretary for Specialized Control of Court of Accounts in Rio de Janeiro State, Brazil. Ms. Schwartz holds master's degree in public health, and her specialization is in public administration and business law. Ms. Schwartz, my question to you would be as follows. So could you please share with us key lessons learned in the context of COVID-19 in Rio de Janeiro, with a focus on health assets procurement, again, about procurement during the crisis. What challenges did you face? And again, what will you do differently in the future? Over to you, please.
Okay, thank you. Good morning to all of you participating from your homes and offices. First and foremost, I would like to thank the United Nations Development Program for this invitation. I feel honored to be side by side with industry leaders from Uganda and Spain, sharing our experiences, actions, and lessons learned during this devastating global pandemic. I hope we all learn from each other and find common solutions for the future ahead of us. Before we dive into the main topic of this discussion, I find relevant to briefly highlight how the public health system in Brazil is structured. So I would like to explain a few important issues. Brazil has the SUS, Sistema Único de Saúde, which stands for Unified Health System. Since 1988, our constitution has defined health as a right to all and a duty of the state. In other words, the state must guarantee all Brazilians access to health services that are necessary without any cost. And it is financed through the resources of the three layers of government. We have federal, states, and municipalities. And Brazil is a very large country. For example, it is larger than the continental United States without Alaska and Hawaii. Due to its enormous size of population of 211 million, the healthcare system is decentralized, meaning it is structured that way to serve all segments of the population, urban, suburbs, and deep in the country. Let me explain this to you. At each level of government, there are public health officials assigned to manage the health portfolio of a certain area. Brazil Minister of Health is the agency in charge at the federal level. At the state level, each state has a health secretariat. And when it comes to the municipalities, municipal health departments. In general, and in simple terms, the federal entity is responsible for guidance and coordination, while the states and municipalities are responsible for the execution and service delivery. For the system to work, each layer of the system has its financial obligations. However, it is well known that our unified health system has always been underfunded and recently aggravated by the political and economic crisis in the past several years. After this brief contextualization, I will explain the situation experienced by the state of Rio de Janeiro and the city and its municipalities during the COVID-19 pandemic. Well, here in Rio, several regulation and action plans were created to combat the COVID-19 and to reduce its spread. However, every country in this planet needed to acquire medical supplies at the same time. The result was that we faced a lot of barriers to purchase medical supplies, especially ventilators, diagnostic tools, oxygen masks, and medication in general. As I mentioned before, even before the pandemic, the unified health system was already facing financial problems to serve the entire population. And at that moment, the situation was aggravated at peak levels. The health professionals had to race against time to increase the number of hospital beds. So you can understand what we went through here in Rio. I will mention some measures adopted by the state to fight the pandemic, including the main problem we faced. Even it became evident how planning is essential for health systems. Despite warning from other countries before the pandemic hit Brazil, we were not prepared to deal with the situation. The state responded late and created an emergency response plan to monitor the evolution of cases. This plan has been updated throughout the pandemic. The number of hospital beds has been increased and protocols to access them were created. However, since the beginning of the pandemic, the State Health Secretariat has had its leadership turnover 4 times, including the removal of one of the secretaries for alleged corruption in the purchase of supplies, unfortunately. In addition, the state governor himself was removed for indication of participating in the corruption scheme. This mess had a negative impact on the process. It impacted the public hospital network, which was no longer sufficient to serve the population. The lack of planning and protocol for the expansion of hospital beds resulted in many unfinished hospitals and consequently many inoperable beds, increasing fatalities at the peak of the pandemic due to the lack of space for patients. Well, meanwhile, there were several irregularities happening, such as overpriced service contracts, supplies not being delivered on time or damaged, and many others. On a positive note, there were progress in transparency. The legal control institution demanded transparency of information during the pandemic to account for hospital beds and healthcare data. I believe a key factor of Brazil's failure to combat the COVID-19 pandemic was the miscommunication and lack of dialogue between the 3 levels of government: federal, states, and municipalities. As I mentioned before, each one of them have responsibilities defined by law, but they failed to comply with their obligations. The coordination between them was quite fragile. There were no set frameworks from federal down to state government officials to guide the municipalities, leaving them with no set structure or action plan. That was the main flaw in our health system and the reason why we are in this precarious situation today. Although we have a solid healthcare system and a huge network of services available to the population, the lack of direction from the Ministry of Health down the chain of command failed to address the surge of this virus, as well as the necessary care for the population. Well, Brazil has had 4 Ministries of Health since the pandemic started. And the reason of the turnover isn't because we are looking for the most qualified person for the job. It is simply political and has not brought positive results to our unified health system or to combat the pandemic. The lack of guidance and synchronized organization resulted in a race between states and municipalities independently after supplies and medication, consequently increasing market value, stimulating competition between public health officials from various cities, and generating shortage of supplies, especially for those local governments with less resources. This could never have happened, as the Brazilian health system is national and unified. Government officials should have managed the offer and demanded accordingly, delivering fair and a balanced healthcare across all regions. Unfortunately, it doesn't end here. Our problem will not be solved with the end of the pandemic or if we get it under control. Local health entities will still have other major challenges. The system is already facing an increasing demand for elective procedures not related to COVID-19, which are non-urgent surgeries or care, which were suspended during the pandemic. To conclude, a key lesson learned here in Rio and throughout Brazil is that proper planning is fundamental for dealing with the pandemic, and that transparency of systems and process increase the participation of society as a whole. But beyond that, the most important element is that a synchronized coordination between all levels of government is essential to improve our national public health system in order to serve all citizens without distinction. In recent years, the universalization of our unified health system has been questioned by many, and some believe that it should only be offered to lower socioeconomic layers of society. Well, the COVID-19 pandemic speaks for itself. The need for a structured and unified health system for all Brazilians without discrimination. This public catastrophe taught us that the Brazil health system has become more evident and essential to fight the virus, that it doesn't choose layers and society. It is the most important public health mechanism aimed at serving the population equally. The real challenge here is the lack of coordination across all layers of government and the fulfillment of their responsibilities. Finally, I understand that in time of crisis, there are many international organizations and governments capable of helping in developing countries such as Brazil with hospital equipment and vaccines, allowing a more equal distribution. They can also help us by establishing healthcare guidelines and protocols to prevent future pandemics and to monitor the treatment of diseases. I hope my explanation was clear, and I'm here to answer any question you may have. Thank you.
Thank you, Talita, for very, very interesting presentation. I really was writing the whole presentation as during Raul's presentation as well. So it seems like you have really lots of lessons from planning to coordination, miscommunication at the different levels of governments, then talking about whole of government approach, basically, and whole of society approach that we at UNDP are also promoting. So in this context, it's interesting because it's been now more than a year and we learned, many governments have learned their lessons. So what steps is the government of Brazil currently undertaking at the national, state, or municipal level, for example, to address those challenges? Because as far as I understand, is that we really need to, and your experiences are not unique, you know, many countries faced it. So it will be really interesting to hear what you are doing, given that we really understand that we need planning and we need emergency strategy, communication strategy during emergencies, and all of that. Is anything being done currently, or how does Brazil or Rio de Janeiro state go about that? Thank you.
Okay, I think I can say transparency, because we are not ready. We are increasing the transparency, but we will have a long way. The municipalities, they don't have much money to afford the transparency. They are really small. Brazil has more than 5,000 municipalities, so some of them are real small, and it's hard for them to increase their transparency because sometimes they don't even have internet to do that. And when the states and the federal government help them, it's easier for them because they cannot do that by themselves.
Thank you. Thanks a lot, Talita. I think we'll have more discussion in the end. And now I would like to pass the floor to our last speaker, but not least, who will be presenting Kampala City's example, Doreen Akatuhwera, who is manager of the Procurement and Disposal Unit of Kampala City Authority in Uganda. Doreen holds a Master's of Science degree in Procurement and Supply Chain Management from Makerere University. She is a full member of the Chartered Institute of Purchasing and Supply from the UK and holds honors degree in business administration from Makerere University. So Doreen, with the vast experience, with the big, huge experience that you have, and in the context of COVID-19, it's interesting to hear your thoughts about Kampala City and how COVID-19 has affected processes in managing infrastructure assets in the city. What mitigation measures did you apply and what recommendations you have to representatives of local governments of other countries that we have present today during this webinar? So over to you, dear Doreen. You have 10 minutes and we'll look forward to your presentation. Thank you.
Thank you, Moderator. Good morning, good afternoon, colleagues. As you've heard, my name is Doreen Akatuhwera from Uganda. I will be sharing with you how we managed infrastructure during the crisis of COVID-19. Allow me to share with you my presentation, then it will guide me on how I structure my presentation. Thank you. Kampala Capital City Authority manages sorry, I still have a network problem here. So my presentation is going to be guided by the short background like that. I'll show you how the effect of COVID-19 has affected us in managing infrastructure, the mitigation measures used to manage the assets and recommendation and way forward. First of all, Kampala Capital City Authority manages the city on behalf of central government, and it came in place through an act of parliament of 2010. In line with its mandate, Kampala Capital City Authority encompasses all the sectors of government, from works, health, education, and all those. Because of time, I request that I jump some of these slides and go to the effect of COVID-19 in managing infrastructure
Doreen,
assets in the city.
If you could enlarge your screen, that will be helpful. The full screen mode, yes, please.
Yes, thank you very much, Moderator.
Thanks.
So the impact or effect of COVID-19 in managing infrastructure assets in the city, the impact of the pandemic was felt across the world. And in Uganda, this country was not spared. But when it comes to procurement and managing infrastructure, it affected us across the procurement cycle. And I'm going to be discussing on each how the impact affected us. If I may share with you, sorry, what is happening? Sorry, people. So our procurement process is guided by that chart from planning and budgeting, market assessment, budget confirmation, tender management, evaluations of bids, contract signing, contract management, and monitoring. In March, when the entire world was shut down, Kampala and Uganda was not spared. All the procurements that were planned were affected. First of all the budgets that were allocated to infrastructure had to be diverted to attend to the medical related areas, especially health sector. So all the plans that we had for road maintenance, buildings, and all those were affected in such scenario. Most of the planned activities suffered due to budget cuts, and funds had to be reallocated to address the pandemic. Tenders that were ongoing, of course, through advertisement and other methods, had also to be halted or extended, and others cancelled, since nobody could predict when the world would open. Tenders that were under evaluation stage were also halted, since most of government procurement processes are still manual in the country, not only in KCCA, but in Uganda, we haven't yet gone fully E. So most of these processes were halted because most staff had to operate from home. Therefore, meetings could not be convened to conclude evaluation processes as provided by the procurement regulations. Projects whose contracts were due for signing had to be extended since there were travel restrictions, and others could not be signed. Projects that were under implementation suffered as well, since they could not get materials due to broken or disrupted supply chains, and others could not be done on time, and others were frustrated under the force majeure clause. All these disruptions led to increased lead times in the procurement processes. There was low response rate from suppliers, especially due to lockdown period. Then restrictions of movement of both government, agency staff and suppliers affected the processes. Overdependence of few suppliers created inflation. Non-availability of goods and services in the long run because we could not sustain sourcing from local people. Then there was delays or cancellation of procurement processes caused by force majeure clause. If I may discuss the measures adopted during COVID, we had to rely on the existing framework contracts or agreements, especially for medical supplies, road maintenance, and those other emergencies. And this came in handy because they were readily available. But this could not be sustained for long because, of course, these providers also had to suffer shortage of materials, and it remained a challenge. Then we opted to use of direct procurements under emergency provisions of our laws and regulations. This also helped us, but of course it needed some committees as provided for under procurement laws to convene. This was a challenging environment, so it could not move on very smoothly, but we had to do it because of emergencies. And then we had to embrace local content. We have a policy as government of Uganda of promotion of local content. This was an opportunity now that we fall back to our local providers, and especially this was used to procure the local masks. These were cloth made locally, and it came in, though information available say that these were less effective compared to the imported ones. But fortunately enough, they helped, because if you compare Uganda today with the rest of the world, the rate of infections really are low in our country. And for us, we believe the use of these masks, and because they were able to cover the whole country of almost 40 million Ugandan people. So we feel this was really a solution that worked, and we've continued to use it. So to us, it is very effective, though scientifically, they are saying it is not very effective compared to KN90 masks. Then we embraced use of technology such as virtual meetings, as we are doing today, for especially handling tender processes, handling pre-bid meetings, handling submissions of suppliers' bids. But of course, all these had to be done by requesting our procurement regulator to allow us to use it, and also development partners. Their guidelines do not allow it, but we had to get accreditation and approvals from them. So it came in handy. I would wish to share with you lessons learned and the way forward. Local governments or the city municipalities need to come up with procurement strategies which must be informed by spend and risk analysis. You see, most of these governments, we've been just buying anyhow. It is time with this pandemic and others to come that we do a risk analysis, we look at spend analysis, then we plan our procurements according to, with informed information. What do I mean here? When we do a risk analysis, we'll be able to see where are we likely to get a lot of challenges. Do we have local providers? If we don't have, must we partner with the international providers? And those must have local representation such that we don't go into a crisis of lack of materials to use. Then I think it is critical, if we are to maintain transparency in our procurement processes, that we work with framework contracting that is based on our procurement strategies of each local government for fairness. Why do I insist on this? It is because with framework contracts, these are advertised earlier, then you attract prices through competition, the processes are handled earlier without rushing, then you sign contracts, and this would be able to take us in Uganda. We contract at least for 18 months. So if you have any emergency, you can place a call of order, the prices will be controlled, the providers will be known, and I think this will minimize the rate of corruption. Then supporting and development of local providers is another way of really responding and maintaining transparency and when you are responding to emergencies. This is to say, if, for example, I'm sourcing from Uganda here, and there is such an emergency and a crisis, and there is lockdown the way it has been happening, it would be easier to source from different providers who are able to provide goods under competitive means. So I think if local governments support and develop their local providers, this would be helpful as it gives sourcing options. Embracing use of technology, such as use of electronic government procurement, like Uganda, I think this is what we are going to benefit from this lockdown, because it has awakened the minds of policymakers that now it's time really to trade online, and this is going to come in handy to help and reduce physical contacts. If I may conclude, responsive and transparent procurement can be achieved through a properly analyzed and developed procurement strategy for all local governments, since this will guide and give an indication of the uniqueness of and the environment of each local government operating. Thank you very much. Yeah.
Thank you, Doreen, for excellent presentation. This was very informative. I have highlighted many interesting ideas of yours, starting from developing emergency strategies, specifically on public procurement, use of technology, relying on local production, and many others. But what is interesting to hear as well is about the government's engagement with private sector and civil society. What has been your partnership with the private sector and civil society? How have you engaged them, and in what capacity? How? So we would like to hear your thoughts on that. Thank you.
Thank you, Moderator. Yes, government engages private sector and civil society for reasons of increasing awareness on public spending and increasing awareness and fight against corruption. And this is also a strategy of having collaboration with private sector. For example, like KCCA recently had to hold a suppliers conference, and this was to communicate to them government intentions of embracing sustainable procurement. This is sustainable procurement was to deal with addressing socioeconomic and environmental challenges, which can better be addressed through the procurement processes. Then the civil society is to carry a message and also scrutinize the government processes, check and find out the level of disclosures government does. So there has been a lot of engagement between private sector and civil society.
Excellent, thanks. And another follow-up question relates to the transparent procurement that you mentioned. So what steps have you undertaken to ensure that procurement process? You had a very interesting diagram, which maybe you could share that diagram now and walk us through it, just so that we see how you ensure that the procurement has been transparent. And you, especially during the emergencies, this becomes really critical issue.
Yes, thank you, Moderator. I think this is...
Or you just might talk as you wish. If it's difficult to share, no problem. Just share with us your thoughts. That's fine as well.
It's here. I can share it.
This is a different one.
Mm.
Yeah. Come to this.
Mm.
Yeah, sure. Was it switching on switch share?
Yeah.
Yeah. Share screen. Share. So scroll up to there.
It's here.
Okay.
Isn't it? Can you see it?
Screen. Okay.
Oh,
yes.
Sorry, it has.
Just scroll up.
Go up. Thank you. This is the chart that governs and defines different stakeholders in our procurement cycle. In color pink, we have procurement and disposal department. Then the red represents the accounting officer. No, the red represents boards. The green, light green, represents the accounting officer and other stakeholders. How transparent it is that when procurement is handling any procurement process, all these workers checks and balances in the procurement cycle. When, for example, the procurement department is preparing a tender, it will have to get input from the user directorates or department. Then we review it together, then we advertise it. When we advertise, evaluations are conducted. You draw different skills from different experts, and that one is also submitted from a committee called the Contracts Committee. These ones will also check how transparent, how fair, how the levels of disclosure. So to us, this one is a check and balance on each role players transparency and fairness. If you can.
Thank you, thank you. Just one clarification. Is it online procurement system or it's not yet?
It's not yet, but beginning July this year, we are enrolling into online procurement process. That's why I said, I think COVID-19 has awakened policymakers' minds that it is time to go online. Yes.
Excellent. Thank you. Thank you, Doreen, very much for this very interesting presentation and the details. And I'm sure the online system will be much more effective and it will ensure even further transparency of the system. So now we are moving to the second segment. We have two respondents, colleagues, as Diana mentioned in the beginning, and I'm happy and pleased to introduce Daniel Platz, who is the lead of Infrastructure Assessment Management of Financing for Sustainable Development Office at the United Nations Department of Economic and Social Affairs, UNDP. So just briefly to highlight that Daniel has over 20 years of experience with UN intergovernmental processes, research and analytics, and technical assistance in support of the implementation of Sustainable Development Agenda. And Daniel, I would like just to hear your thoughts about what our presenters, speakers have presented just a couple of minutes ago and during this webinar, and also how the work that cities have been doing relates to the work of UNDP in asset management. Thank you. Over to you, Daniel.
Thank you so much, Aida. I hope you can hear me okay. Okay, great. Yes, thank you so much for having me at this panel. Thank you, of course, also to Diana, who has been such a steadfast and reliable partner in this rather new area of infrastructure asset management for, at least for UNDP. Thank you all panelists for wonderful presentations. I have a PowerPoint presentation that is too long, but bear with me. I'm gonna race through it and focus on the things that are most important. I will share my screen now. Oh, okay. It says screen sharing is disabled. If you can, Diana, if you can enable screen sharing for me, it would be great. Let's try again. Perfect. Okay. All right. I'm going to go into presentation view. Can you all see my PowerPoint? Perfect. Okay. So as Aida said, my task for today is to respond, but also to talk a little bit about how UNDP and in fact the UN system is embracing this new area of asset management and really trying to help cities around the world in promoting more effective asset management practices. And as we do that, we have as much to learn as to give. And so these events like today are incredibly useful for us. We all talked about infrastructure asset management, but perhaps it's useful to just maybe put forward a possible definition. There's many out there, but when we talk about it within the context of our technical assistance work within the UN, when we refer to infrastructure assets, we're not only referring to those typical facilities that come to mind like road and water, electricity grids. Those are essential, but we're also looking at the land that roads are built on, the buildings that house essential services, and so forth. So it's also sort of the equipment that needs to be there to run infrastructure. So we're looking at the whole supportive system that allows infrastructure to run. And when we talk about asset management, it's really about a series of activities that monitor and maintain these things of value, right? And these activities, we talk about public services, are in the public domain. They're either done by public agencies, by local governments, and of course also by national governments, assets that are spread over many states, over regional highways, things like that, often airports, bigger assets. Sometimes the electricity grids are managed by national governments. So today, listening to you was really enlightening, really helpful for us. These are just some of the key messages that were already summarized by Aida to some degree, but what I took away from Raul, for example, was really what made Malaga's experience quite successful is the idea to empower the right people to make the right decisions at the right time in the right way. So you were talking about adjustments in legislation, the online platform that you put through, but also the willingness really to learn from others. I think it was mentioned by you, Raul, that we really need to share more experiences among cities, and this is exactly what Diana has been trying to do with this webinar, right? So we need more of these. From Talita, I really want to commend her for making such an honest, spot-on presentation of what the problems were. Often when we go to webinars, people focus on the success and try to sell things as a success and minimize challenges. Not so with Talita. She really went straight at the heart of the problem, and that is not only a problem of Rio de Janeiro. We've seen that, and we're still seeing that all around the world, in developed countries, where we see corruption, we see lack of coordination among different layers of government. No one really knows what the other one is doing. You see political maneuvering, high turnover, and underfunding, and all that is incredibly harmful by itself. But during an emergency, it becomes fatal, right? So all the more need to tackle these issues. And then Doreen, when she talked about the experience of Kampala City, and most of us know that Kampala City is really has really come a long way in more effective, implementing more effective infrastructure asset management. The importance really to be flexible, to embrace what is there at the local level if supply chains are disrupted, to use innovative technology like e-procurement in your processes. And also what I found striking is how she explained the manifold effects of COVID on the procurement process, and even macro effects where we see supply chain disruptions lead to smaller number of goods being sold on markets, and that then leads to inflation, right? So they're, these effects are really manifold, they're big, and understanding them is not so easy. But I was also very impressed here what Kampala City did in order to respond to the emergency. So thank you for that to all of the panelists. Let me now move over quickly, and again, I will jump some of the slides to what the UN is doing on asset management. And it's really an effort that results from some years of work in the field on asset management, where the UN, with partners like UNCDF, but also UNDP, UNOPS, and local governments and national governments, sorry, my dogs are barking. We went into the different into 4 different countries and tested a few pilot tools. One tool was a tool to assess how asset management, infrastructure asset management is done at the local level, and we applied it in a few local governments in different countries. And then based on that, we developed some tools and templates that local governments can use to change their asset management practices to make sure they take a long-term approach. We went into Bangladesh, Nepal, Tanzania, and also Uganda for about 4 years. And then based on that, we put together the lessons learned with the help of many people, including Diana, including Jean-Francois, who will speak after me, and perhaps others that are on this webinar. We put together quite a massive publication that is called a Handbook for Local and National Government on Infrastructure Assets, Managing Infrastructure Assets for Sustainable Development. And that handbook is really nothing that should gather dust on the shelves, but something that should be applied practically, and it is very readable, it's very accessible, and it contains many, we found, useful tools. It is available for free on our website. It is available in French, Spanish, English, and we're translating it into all UN languages, including some local languages as well, based on demand, like Swahili, Bangla, Nepali, and Serbian even. So it'll be available in most of the local languages that we have seen, where we've seen demand. And it contains these two parts, where in the beginning we introduce the reader, to the local government officials, to the fundamentals of asset management, and then we go into focus areas that talk a little bit more about how to respond to climate change challenges, how to respond to health emergencies, how to capture the right data, and how to build an enabling environment for asset management. And I'm just racing through this, but this is basically what the book looks like on the inside. So we spent a lot of time to see whether we can visualize the challenges and the proposed possibilities to respond to those challenges in a way that is relatable and accessible. And these are just a few different tools we introduce here. One tool that has become quite successful is called the Asset Management Action Plan, or we use the acronym AMAP. And it's a step-by-step approach how to see what your problems are with a certain priority asset that you can identify yourself, like water or waste management. It's always good to start with what is most important. How you identify those challenges, and then you go through a step-by-step process to develop an asset management action plan. And you do that in a group. We invite the engineer, the procurement officer, the finance officer, the community development officer. A group of 4 or 5 local government officials is the right group to design such an asset management action plan for a priority asset. And then you present that to your local council. Your local council can adopt it, revise it, and when it's adopted and also endorsed by the mayor or the city director or the town clerk, then it becomes reality, right? And so these are useful tools that are all in the handbook. Again, a few more charts that show you how it is written. Now,
2 more minutes, please, if you could wrap up.
I'm going to wrap up. Okay, sorry. Yes.
Thank you.
And so, what the book also does, it goes into what it means to adjust your asset management action plans to a scenario where there's a health emergency. And I won't go through that, but the key message here is really that core infrastructure assets are an important resource for local outbreak control and for the social and economic recovery programs that come after wars. And there are many tools in the handbook that show how you can increase your emergency preparedness through better asset management. I'm gonna jump through this, and basically just to show you this, what we've done there is, I just mentioned the asset management action plan. So what the book does, it looks at your asset management action plan and it shows you, once you've done that, how you can emergency proof it and turn it into an emergency response asset management action plan. All these concepts are rather new, so I invite all of you to, I'm going to stop sharing now, to look at it and give us feedback and see if they're really useful and how we can improve them. Sorry for going a little too long, Aida. Thank you very much, everyone.
Thank you, Daniel. I think this is really a very interesting handbook, and it's a repository of information regarding the asset management, and that is UN's contribution for, asset management at the city level, regional level, national level. And I think that our participants will benefit a lot from this handbook. And I will read it myself because it's interesting for the anti-corruption work. So I will do that definitely. Okay, so in terms of, in the interest of time, I'll move now to Francois Habeau, who is our second respondent. He is Executive Director of Global Fund for the Development of Cities. And Jean-Francois brings 15 years of experience working with central and local governments from all over the world, and he acquired an extensive expertise in local finance and investing and strong skills in working with public entities, donors, and investors. So Jean-Francois, could you please share your knowledge and experience of how local governments are addressing the issue of transparency in asset management globally? It will be really interesting to hear some concrete examples, and then maybe we'll have also some follow-up questions in the discussion section. Over to you, please.
Thank you very much, Aida, and thanks to all the speakers for these very great experiences that were shared with us today. And actually, I started to make the points that Daniel covered already, so I will go directly to the point of transparency, because indeed, I think that the need of the cities were really to focus on adaptation and mitigation of the impact of COVID. And one central point of that is the connection with citizens. So how do you change the rule of public tender by informing also local citizens in order that they don't see that as corruption or as a direct connection with specific private entities? And that's all the difficulties to adapt from a local perspective to this emergency situation, but being also transparent and inclusive on how do you adapt that without any criticisms from a political perspective or even from the citizens. So we saw a very good example from a platform being developed in Kampala, in Malaga, but also with Doreen to adapt and to integrate also the local stakeholders in the tenders processes. So that's something that is very interesting, but maybe also to go beyond that, cities, they need instruments, they need guidelines, they need examples of what can be done, and there is a need to share these experiences between the cities. For example, participatory budget are very well developed. It's when a city is opening one portion of the budget to be voted by the citizens in order to ensure that the choices that are going to be made by the city is backed up by some citizens. In time of COVID, I think this is also critical to try to enlarge or to engage participatory budgets, such as an example. But also, we saw that some cities developed some application on their mobile in order to be better connected to the citizens and to see what are the expectations, what are the needs from the citizens in order for the cities to be very reactive in the way they can answer to these emergency needs. And sometimes it was a question of surviving, on having access to medicines, but also to some supplies like food. So the cities played this role that they never played before. So to adapt that, I think there were some very good examples also on these new form of communicating with the citizens. But even beyond that, I think these participatory approach, I'm very insisting on that, because for me, it's the best contract that a city can propose to citizens on guiding the cities to be sure that they are making the good choices, and to open to citizens the way they see the adaptation of this critical situation. So I won't go into a list of examples, because there are many of that. We've developed together with Diana a few years ago a platform named Uraya with a lot of examples online. So if you want to have additional thing on this, you will find very good case studies. But I really wanted to insist on this connection with people, transparency, and accountability. Why a city is taking these choices? It's for the good of the citizens. It's not for like individual choices or individual benefits. So I will stop there because I think many things have been done already. And again, thanks for the Thanks, Diana, for bringing everybody here to this very great session.
Thank you. Thanks a lot, Jean-Francois, for also giving this great summary about engagement, participation, about sharing examples and experiences. I think these were on my summary points that you have already highlighted. We have one question to Doreen about how did Uganda manage the demand for mass public transport. Doreen, please, over to you, maybe 2 minutes, and then you could exchange emails in case, or Diana, could you link up in case you would like to interact further for more information? Thanks. You are muted.
Sorry. I've already answered that on the chat. But briefly, Uganda was put under the total lockdown with the exception of critical workers. And by that time, public transport was opened. Only public transport means we're allowed to carry half the capacity to ensure social distancing, because we believed that prevention is better than trying to cure. Thank you.
Thank you. Apologies, Doreen, I didn't see you responded. Thanks a lot. And we have a question from Daniel about what mechanisms are in place to share at city local government lessons on procurement during emergencies at a national level, I guess. Could we improve those mechanisms? So Talita, Doreen, if you would like to briefly respond to this.
Thank you, moderator. I think I can come in first. What has worked for us? Uganda has ever hit by Ebola, as you may be for information purposes. And from that experience, we learned to do what we call procurement strategy that is always informed by risk analysis and spend analysis. Like in health, we try to allocate enough budget and we sign framework contracts with service providers of medicines and medical supplies. Then we also do assessment of floods. Kampala is a bit in between the hills, so we are prone to floods. So we also do risk analysis and sign framework contracts with contractors and the people who supply equipment and machines. So it has worked for us because when you have an existing framework contract, you are giving the service provider assurance that you have business and they will stock for you. And when you sign a framework contract with someone providing medicine and medical supplies, and we emphasize on what we call vendor managed inventories. They keep the drugs, we only order on demand. So we don't usually run short of supplies, except for this pandemic of COVID-19, which affected the whole world. Of course, at the beginning, we were sure of supply until when we entered into a year, when exportation could not be done with ease. And that's when we started facing it rough and we opted for local production, especially when it came to hand sanitizers and face masks. These we had to use cloth and we had to produce. I can show you, like, this is a locally produced hand sanitizer from Uganda, and it has been effective. Thank you. We could do better. I mean, we could do better if we also learn from other people, other countries where they are running, if there is anybody that can share, but at least this is what we've been using in the country here in Uganda. Thank you.
Thank you, Doreen. Before giving 2 minutes to Talita, just to highlight that Mr. Maldonado had to leave because of emergency. So unfortunately, we will not be able to ask him any questions, but I'm sure if you would like to contact him, please contact Diana and she will link you with him. Talita, over to you just for concluding remarks and answering this question. Thank you.
Thank you, Aida. I think we have to have proper planning, and the federal government or the states and municipalities, they can help each other because, as I told you, we have more than 5,000 municipalities. So protocols and guidelines, they are focused on the sanitary advisal. It is hard to talk about this, but we have our internal problems, and we try not to be political, but sometimes the protocols and guidelines are. So I think if we have this established, it will be better for us. And also the coordination between those layers that I told you already, and also speed up the production of the vaccine supplies, because we are like, after a lot of countries, we have about 20% of the entire population of Brazil vaccinated, and with 2 doses. So I think protocols and guidelines will help a lot.
Thank you. Thank you, Talita. I think before we move to concluding, and I have just highlighted a couple of lessons learned. If anybody has any question, you could also go, put on your camera or without camera and ask in person. So you are most welcome. And in the meantime, before also passing the floor to Diana after I conclude, I'm just waiting maybe for 10 seconds if you would like colleagues to ask questions. If not, then just to thank everybody for their active participation, and especially speakers, respondents. Thank Diana for organizing this interesting, very informative workshop. I think I'm now excited and would encourage you to organize another one when you have new examples and see how the handbook is being utilized and what cities are learning from each other's, etc. So I have 7 points to highlight here just to conclude, and then I will pass on the floor to Diana. So we heard from most of speakers about lack of budgetary allocations for healthcare, and there was scarcity, of course, during the emergency situation. So I guess that having emergency budgets or budgets for force majeure situations are really a smart way to go in the future, just to have, put aside, despite the fact there is emergency or not, just to tap into it when needed. Lack of capacity at the local level, that was, to address emergency situations where we really need to engage more people, or maybe have some mechanisms to hire volunteers, to train them during the peaceful time, non-emergency time, non-crisis, and then engage them as needed. I have heard across about multi-stakeholder engagement, and it's been mentioned about whole of government approach, engaging private and public civil society, and city examples have highlighted the importance of that. Technology as a means for transparency and accountability, checks and balances, and engaging of civil society here is also critical. I liked planning by Talita, and yes, you are right. And in this planning, we mean the strategies for public procurement, strategies of communication in emergency situation, capacity building, etc. And last but not least, more exchange of knowledge and experiences among cities. And I think we also, as UN, should think how to maybe organize similar webinars to engage participants and to hear the richness of experiences that everybody has. And so I think I will stop here, and I would like to thank you again. We are right on time. It's 10:29. And Diana, over to you for 1 minute and we'll be on time. So my mission is accomplished. Thank you. Thank you, everybody. It was a great pleasure.
You did a great job, and I don't have anything to add to your very impressive wrap up, because there were a lot of questions. You open with procurement, and then you discover that the city is interconnected, and you start talking about procurement, comes public participation, comes planning, everything comes together in the city. So just thanks the participants. This is part of an effort to bring the people together. So it's, and we always build new initiatives with you, listening to the cities, listen to the needs of countries. So we will keep you updated about what this first event between UNDP, UN Capital Development Fund, UNDESA, and FMDV will bring us. And I will be sending you the recording link when this is on YouTube, and we'll keep you updated. So thank you very much for your participation. Special thanks for the interpreters, and to Talita and Doreen, you were great. Thanks a lot to all.
Thank you, everybody. Have a great day, evening, afternoon. Take care. Bye-bye.
Thank you.
Bye.
Bye, thank you.
Bye-bye.
Bye.
Bye-bye.
Thank you.
Bye, Talita.
Bye, thank you.